Yeah. Okay. I have to say, got it. Okay. Oh, he goes that. He's a girl. Oh, I fixed my name here.
I think we are live.
Oh,
I think we are live. All right. This is so exciting. Okay, it says that we're live, so we're going to go with that. I've got another computer off to the side just to test and make sure that everything is working okay, but it looks like it is, so I'm going to mute that. Welcome, everybody. It is currently, I guess, 7 o'clock Eastern, and my name is Stephanie Shipley. I'm the current chair of the Professional Animal Care Certification Council, and I could not possibly be any more excited to welcome our guest tonight, Dr. Jennifer Chatfield, DVM, and many other letters, including Z and Z and all of those other things that come with it. Dr. Jen, thank you so much for joining us tonight. We're talking about canine cough tonight. Are you ready?
Oh, I'm ready, Stephanie. I'm super stoked.
This is so exciting. So before we get going, I'm just going to pull this down to make sure that I've got the comments coming in. If you are watching this live, please drop us a little note on where you're from. Say hi. I see that Tracy is on, Tara's on, Peggy is on, Nicole's on from Washington. We got Maryland, we got Canada already. So I expect that we have some pet parents, we have some board members, we have some facility managers already. So if you're watching this, please drop us a line so we can take a look at where everybody's watching from. And certainly I'm watching the comments come in. Okay, somebody's asking what the pup's name is. Dr. Jen, what is the pup's name?
This is Mademoiselle Cosette, the farm fresh Frenchie.
Nice. That is Cosette, and she is lovely. She has her dentist stick down there that she's going to be working on in a minute, but there was no way that we could bring this many pet people together and not have a pup make an appearance.
Yes.
So,
okay.
Welcome, Cosette.
That's about all she can stand, because you're right. She has a little treat here that I have for her. So I'm going to give her that and put her on her giant pillow. And hopefully she will behave for all of us. But you can see with the Breaky breed why I love talking about how to deal with respiratory infections, right?
It's so exciting. This is so exciting because we are bringing it, like I'm looking here, we've got Manitoba, Canada, we've got New Zealand, we've got Miami, like we're all over the place. So let me just give kind of the preface. So the Professional Animal Care Certification Council, otherwise known as PAC, our mission is to lend more credibility to the pet care industry via independent third-party certification via writing exams or sitting for exams and passing and proving a body of knowledge for pet care professionals. So the one thing that I will ask anybody watching this, if you are a pet care professional that runs or owns a dog walking or grooming or pet sitting or kennel or daycare or whatever it happens to be, recognize our responsibility in the community to provide a happy, healthy, safe place for these pets, and help the pet parents discern those who are qualified to do so and take education in this industry very seriously versus those who either don't or haven't been certified enough to prove it. So what we're asking fundamentally of the pet care providers is, if you're good at what you do and you know what you're doing, take 2 hours, sit for the exam and prove it so that the pet parents know, your motivation for getting into this industry. And that is placing the well-being of the animal as the primary business consideration above everything else. If you're a pet parent, please start asking your pet care providers whether they are certified to do what they do for a living or not. And if they're not, it doesn't mean that they're a bad pet care provider. It just means that they could take the step to become certified. And what we're asking, what PAC is asking, is let's help the pet parents and the public and in the community in general start to have a fair fighting chance at identifying the people that take this industry very seriously and want to keep it happy, healthy, and safe for the pets. So you can find out more about PAC at PACCERT, PACCERT.org. That's where you'll find us, but we have much more pressing issues to get to today. Dr. Jennifer Chatfield, you hail from the state of Florida.
Yes.
You are hosting and instructing with your twin brother, Jason, I believe, Dr. Jason.
Yes.
Dive with all things serious.
Yeah.
Yes. You guys are conducting the Heroes for Healthy Pets at the IBPSA Business Flow Conference in just a couple weeks in Florida. And I do believe that is free for people to attend. You just have to pre-register to make sure that the room isn't busting at the seams. So for those of you who are interested in knowing more about this topic and other infectious diseases, I'd highly encourage you to attend that session at the IBPSA conference in only a couple of weeks from now. But Dr. Jen, why don't you tell us a little bit about yourself?
Yeah, and also Stephanie, thanks for number one for hosting this tonight and gathering up all the questions, and thanks so much for mentioning that Heroes for Healthy Pets program, because when Jason and I deliver that, there's some PowerPoint slides that go with it, but what I have found and what I enjoy more is having it be more of a discussion time for folks who are there. On point, we stay on the topic. We don't go off on rabbit trails and that sort of thing. I mean, unless they're interesting rabbit trails.
But then they're worth it.
Right. But really what I think people find most valuable about it is that we talk about infectious disease, we talk about prevention, mitigation, causes, we talk about vaccineology. Why do we give vaccines and when, which vaccines, all of that. But what I like to bring into it is all of the experience that facility owners have, that animal care professionals have, because everyone has had a different experience, and that makes it so much more relevant and so much more entertaining for me to talk about. And so I really look forward to delivering that. I love that program because of that kind of contact and that peer-to-peer type of discussion that we get going during the program. So yeah, so if you're going to be at the IBPSA, or if you're on the fence about coming, you should come and you should register for Heroes for Healthy Pets, because it's going to be a good time, but it's going to be a great time to pick up some pearls of information.
I think that's absolutely huge. And I don't think that you can have too much education when it comes to infection, because our jobs are to keep pets, whether they're our own pets or other people's pets, happy, healthy, and safe.
That's right.
And there's a lot that goes into that, and it's a big responsibility that pet care providers shouldn't take lightly. But let's dig into respiratory. Okay. You know what? So I'm looking at, we've got Oakland, California, Charlotte, North Carolina, New Brunswick, Canada. We've got a whole bunch of people on. I'm gonna start off with the pressing question.
Okay.
Are you ready? I know.
I'm ready.
Okay. Is kennel cough a thing? Is it a diagnosis? Is it a diagnosis, or is it something, is it a term that just follows, also known as, like, when somebody says, oh, my dog has kennel cough, is that the same as has diabetes or has cancer? Like, is it I need you to help me understand this, because pet owners get told that their dog has it. Facilities get told by the pet parents that their dog has it. Like, but can you have it?
Yeah. So I love the way you phrase that, because I also, I have on my YouTube channel, my show, Veterinary Translations. Is this a thing?
Right.
Because I get asked that all the time about all kinds of different issues. I'll get a text, hey, Jen, is this a thing in my pet? So kennel cough, besides being to some degree the bane of many people's existence, especially if you work in a shelter, if you work in a kennel, for heaven's sakes, it has become a bit of an antiquated term, because initially, like 30 years ago, we came up with the term kennel cough, right? And the reason people called it kennel cough was because usually dogs that lived in giant kennels, and I don't mean boarding kennels, I mean from before boarding kennels were cool, right? So, I mean, like hunting dog kennels, dog kennels like that, you know, where you have 300 dogs. Those were the populations that most often we would find this upper respiratory hack in. And it was caused at that time, we thought it was caused by essentially by a single bacteria. Okay. And that bacteria is Bordetella, right?
Okay.
Sure. And so now what we know is that that's not true. That's not true anymore. And so you hear Cosette is being terrible right now.
I love her so much.
Because she's only 8 months old and I'm not paying attention to her right now. So we're having some growing pains here.
It's okay.
But don't worry, her grandma is coming to get her.
Oh, did you just text your mother?
Yes.
I
Because
love it.
I mean, it's embarrassing when the veterinarian's dog won't stop barking when she's on a Facebook Live. So, with kennel cough, what we know is what people use the term to refer to now renders the term inaccurate and antiquated. So what people mean and what they should say is CIRDC, right? Or upper respiratory infection, right? URI, because we now know that the majority of these respiratory infections in dogs are multi-pathogen, which means there's more than one bug, more than one virus or bacteria causing the problem. It's not just an infection with a single bacteria, like the 30 years ago infection that we talked about. And we actually now know that kennel cough, what people talk about, that syndrome, the canine infectious respiratory disease complex, that's why we say CIRDC,
right?
Most often is held together, like the glue that holds that family together to cause the infection is usually para-influenza. It's not.
Whoa.
Yeah.
Whoa. Okay. Let's just be clear. Para-influenza is not the same as canine influenza.
Correct.
Okay. I just want to make sure pet parents, because sometimes facility owners and pet parents hear influenza and we go to the dog flu.
Right. And that's a great point. Those are two very different things, right?
Okay.
There are two distinct viruses. There's canine para-influenza and canine influenza. They're distinct, right? They're kind of cousins, because they both can produce respiratory illness. And in fact, these days, most of the time, like when I find out about an outbreak of canine respiratory disease in an area, it's often either canine influenza or canine para-influenza.
Right.
I mean, I just never really hear about a true Bordetella infection. It's almost always para-influenza with mycoplasma, right? Because I said para-influenza is like the glue that holds the family together in these infections. And we know they're usually more than one offender in the dog's nose. And so it's usually para-influenza plus a mycoplasma, or para-influenza plus strep zoo, or para-influenza plus the other mycoplasma.
Right.
So the term kennel cough, just really, if you want to sound intelligent in social circles, just eliminate that from your vernacular. But also, here's the other thing. So when I talk to dog owners and their dog comes in and it's coughing, and they'll say, but I don't know where he got this cough because I haven't boarded him in like 6 months. And I say to them, well, you know, did he take him to the dog park? Do you walk him in the neighborhood and let him say hello to his little friends in the neighborhood? Did your old college roommate come to visit and bring their little dog to stay with you for a weekend? Right. Any of these things can be a source of infection for a respiratory infection in dogs.
So is it possible, because as a facility owner, you get that all the time, like, sorry, not all the time, I guess it depends, but you get the client that will come back and say, you made my dog sick. My dog doesn't
Yep.
go anywhere ever
Yep.
except they came here to daycare a
Yep.
week ago.
Yeah.
Is it possible to get canine cough or CIRDC by like my dog sniffing a fire hydrant that an infected dog sniffed 30 seconds before?
I mean, yeah. I mean, there's all sorts of possibilities. So coming to the conclusion, okay, first of all, with the statement that my dog only came here, this must be where they got it.
Right,
Okay.
we get that a lot.
Okay,
That's usually how it ends up.
Right, and so I find that interesting, only because I love pet owners. I truly do. And I love them because as soon as they come through my practice doors, they're a good owner, right? I don't really care what's going on with their pet. They didn't have to come, right? So number one, they noticed that their pet needed something and then they acted on it, right? And then here they are. Okay.
Right.
So they're already a good owner. And so I say that to preface my comment here where I say, pet owners, pet parents, they don't lie to me, but they don't always tell the truth, right? And by that, I mean, frequently, because I think that people who operate boarding facilities and work as part of the pet care team, right, which is what I look at, boarding facilities, doggy daycares, et cetera, they're part of the pet care team. So other folks that are in that pet's life, I think they get the same kind of communication, right? And so when a pet owner comes in to me and they say, no, my cat never goes outside. My cat never goes outside, right? And I'm like, okay, sure. And then inevitably, over the course of the conversation while I'm examining the pet, or immediately if they have a teenager with them, the teenager will go, well, yeah, but remember that one time,
Right.
Okay.
Right.
And that's why I say they're not lying to me. They're just not telling me the truth because they don't remember that. They have forgotten that. Okay.
It's not malicious in nature.
No.
It's not malicious. It's just,
no.
They also don't know what truth to tell.
Correct. And so here's the thing. It takes this long for a dog to be exposed to a pathogen that can produce a really nasty infection, right? This long. And so whether or not there was a bunch of schmutz from a sick dog on a hydrant, whether there was, they went to Lowe's home improvement store, or they went to the Home Depot and they rode in the cart, or they got on the floor or whatever. There are so many avenues for infection with any of these pathogens that can produce this infection, right?
Okay.
This complex.
Okay, that's very fair. That's fair. I'm just checking. I'm just taking a peek and seeing our friend Carmen Rustenbeck has joined us. Do you know Carmen? I think she's watching today. So
hey, Carmen,
a big shout out to that. I knew that you would want to know that. So so another big one. I'm kind of trying to answer all those questions for the pet parents too, and say so that would, I guess, explain my dog is vaccinated. How can they get it?
Yeah. Okay.
That's the thing. So they're usually vaccinated for Bordetella, right? Which is one pathogen, one element. So what would you say to that?
So here's the thing. And again, I'm so glad you brought this up. You know that old saying, I think actually it's a quote from Maya Angelou, and I'll condense it because I'll get to the part that I like, which is, we did the best we could with what we knew at the time. And now that we know better, we do better. Right. You know that one?
Right.
And so, it seems like every year we know more, right? We know better. We better understand, the nature of these infections. And so in turn, we better understand how to prevent them. Right. So I when I'm in practice, right, because I still practice because I love pets, I don't vaccinate just for Bordetella infection.
Okay.
So what I recommend and what I provide for every dog, now, of course, vaccine recommendations from a veterinarian are based on a dog's lifestyle and their risk for exposure and infection to that pathogen, right? So the majority of dogs, social dogs, right? It just so happens that like every dog in the Western world has a very similar lifestyle. So a lot of them get the same vaccines. And so what I do is I prefer one that's intranasal. And it vaccinates not only for Bordetella, but for parainfluenza.
Okay.
And the reason for that, but then also the injectable, like the combo shot that I give, some people call it a DHLPP, some people call it a DA2PP, with lepto, always with lepto. That injection also has parainfluenza. And so some veterinarians,
one of the P's.
Right. And some veterinarians will say, well, I don't need to do up the nose with parainfluenza because I gave an injectable with parainfluenza, right? Well, let me share with you why I do both. Okay. So I do both, especially in puppies, and why I would recommend that boarding facilities and doggy daycares and groomers, for that matter, consider working with their veterinarian, right? Because we always want to promote having a veterinarian kind of in the mix, in the discussion for these guidelines for safe practices for facilities. Discuss with their veterinarian, recommending that intranasal vaccination that contains parainfluenza, because parainfluenza is a respiratory pathogen, right? So it infects the respiratory tissues first. And so if you're vaccinated with just the injectable, think of that as like protection in the bloodstream. Okay. Well, I want to protect in the local tissue, because if I just protect in the bloodstream, it takes a little bit of time for the parainfluenza, the virus, to notify the bloodstream that it's in the nose. Okay.
Right.
And so it sets up a little infection. And it may be subclinical, like the dog may not know it, you may not know it, but the dog can shed it. Okay. And so, but then it gets in the bloodstream and then boom, the immune system wipes it out, right? But if I do the intranasal and the injectable, I've cut that pathway off, because I have provided local tissue immunity as well as the injectable.
Okay.
Right? So I've done both. Okay. It's actually, I hate to say this word on a Facebook Live, but it's similar right now to the phenomenon we're seeing with COVID.
Sure
with
it is.
COVID vaccine.
Yeah.
Yeah.
So so the intranasal, so you're saying the DA2 PPV or what that combo shot, that's the injectable, and then the intranasal for the Bordetella / parainfluenza.
100%. Yep.
As opposed to the DA2 PPV over here and the injectable which is just Bordetella.
Yeah.
And I'm very, very specific, because we had a question. Do you still recommend the Bordetella vaccine? And if so, how do you feel about oral versus nasal? What about the oral one?
Yeah. So I just tell you, so the data indicates a better local tissue response with intranasal.
Okay. Tracy Martulio, I hope that answers your questions. Mike McIntyre from New Jersey is saying, are there any risks with doing both?
Oh, good question. Love it. Yeah, Mike. So I also get this a lot, right? And that's a little bit of a deviation from just respiratory, because I think, Mike, what you're wondering about is, am I over vaccinating? Right? Okay. So let's start with recognizing that anyone that tells you there's zero risk for a vaccination of any kind is lying to you. Okay. Fair. There's always a risk, right? Let's not be ignorant. Okay. So there's a risk. However, those vaccines have very low adverse reaction rates. Okay. So could it happen? Well, duh. Right. Of course. Like, again, if someone tells you it's zero, they're lying to you. But it's very, very low. And the diseases that we're vaccinating for are 1,000 times worse. Right. Now, I made up the 1,000 times ratio, Stephanie, just so you know.
I got you.
I got you. Yeah.
I got you, Dr. Jen.
Yeah. But people do worry. Like, Mike, that's a great point, because people do worry. And I feel like probably kennel facilities and doggy daycares, they probably hear from pet parents like, I don't want to vaccinate my dog all the time. right? They worry
Right.
about vaccines. And to that, I say, number one, you're a good pet owner because you're concerned.
Absolutely.
But talk to your veterinarian. And if you don't trust what your veterinarian's telling you, get a new one. Okay. You should trust your veterinarian. But show me a dog or a creature that died from over vaccination. Where is the risk? Show it to me. If they are prone to adverse reactions, that's different.
Sure.
That's different. Then you medicate that. You pre-medicate for it. You try to stop that reaction, and you assess that situation, right? That's why you should trust your veterinarian, because that can be very, very scary. But if they are not prone to adverse reactions, they've never had one, point to the creature that has died from over vaccination, because I have yet to see that.
Okay. So what about the person that says, okay, I'm going to get the DA2 PPV, I'm going to get the intranasal, and I'm going to get the shot?
Oh, the shot, the injectable Bordetella.
Yeah.
Oh,
What about that person?
I mean, you can do that. I suppose you could do that. If you asked me for that in my clinic, I would say, where is this coming from? I would want to know, because to me that's a little
That
bit of
overkill? Okay,
Yeah,
fair enough.
that to me that's too much. That's too much.
So here's a big question for both
Yeah.
pet parents and facilities.
Mm-hmm.
How long after a dog receives the injectable can they be safely in an environment with other dogs? And how long after they get the intranasal can they safely be in an environment with other dogs?
Yeah, here we go. Intranasal for the win, right? So
Really?
yeah,
Okay.
intranasal provides local tissue immunity, I think within 24 hours after administration.
So they're not shedding and spreading at 36 hours.
No. Now what you can do is you can always read the package insert. Okay, friends.
What?
But by and large, the rule for any injectable vaccination is 2 weeks. Now, sometimes is it 10 days? Yeah. Sometimes is it 12 days? Yeah. So we say 2 weeks.
And is that to perfect, that's until the pet that received the vaccine is fully protected.
Mm-hmm.
But is there any point after a vaccination for CRDC,
Mm-hmm.
either oral, intranasal, or injectable,
Mm-hmm.
that it's a live virus that they could then spread it to the other dogs?
I think not. Yeah. So that is a good question, because a lot of times intranasal, in any creature, a lot of times if you have an intranasal vaccine, like we used to have intranasal vaccines for kids, those are a lot of times modified, what we call modified live. So they are attenuated, they're changed in some way, so they're not pathogenic. But I would have to, depending on which manufacturer it was, I would have to look at the data, but that's knowable. That's discoverable.
Okay.
That's not like a secret. We can find that out. My gut reaction is no. I think that's fine. I think you can up the nose and tomorrow put them in a kennel and they're fine. I don't think they shed live virus. But that's something I would have to get back to everyone about.
Would you be willing to check on that and
Oh,
let
sure.
me know? And then I'll put
Oh,
it
yeah.
on the PAC Facebook page, the answer to that. Because that's a big one. Because a lot of facilities say, oh, you have to wait 7 days until, but you know what? The funeral is tomorrow. And you're like,
Right.
okay, well, do you accept the risk that your dog's not fully protected?
Correct.
But there's essentially what we think on the surface that you're going to get back to us on is that there's no risk to them sneezing and sneezing out live virus to the dog next to them.
Yep.
So we'll confirm that.
Yeah. So, so there is something that facility operators can do about that, right? I don't know, because you don't like, client is in front of you. They need to board their dog because of some, like you say, a funeral they have to go to or something like this. They have something out of their control that's happening and they're tardy with their vaccinations. right?
Mhm.
So that is sometimes a case by case decision, but those case by case decisions are usually what bite you on the rear end as an
Right.
operator, right? And so, but because also if it's a dog that you board there all the time, you know the owner, you've known them for years, man, that's a hard thing to do, right? The customer's always right. You really want to have some way to accommodate them,
Right.
especially if they have a nice dog that you like, right? So,
Sure.
yeah. So I think we are at a point in the industry where facilities could consider having an isolated kennel
Okay.
where if you're going to break your protocol, and you can't do it all the time, but if you're going to break your protocol, because you have to think of the health of every other pet under your care at the
Right.
time, right? And the protocols work for a reason, right? So you don't want to deviate. But if you had truly isolated kennel, then maybe you would have some way to accommodate for very short term, overnight or something, this client's dog that's out of date on their vaccinations. But it's something to think about.
Right. And normally, and for a lot of us, I mean, it's like they might be a week late on their vaccinations. It's not like every antibody vacates the
Oh, yeah.
building, so to speak, on,
Yeah.
oh, it's September 2nd. We all got to get out now. It's been 1 year. It's been 365,
Yep.
days. So
Yep.
the efficacy obviously would be deteriorating beyond the expiration there,
Mhm.
the vaccination date, I suppose. But
Yep.
that's a big question is, I got my dogs, Bordetella vaccine yesterday or 3 days ago. Can they come?
Yep.
And a lot of facility owners are saying no, because not to the risk of that dog,
Mhm.
but the fact that they think that they're
Could be
going to be
shedding.
able to spread. That's
Yeah.
right, to shed a live virus. So that's really great information to know.
Mhm.
Do you have any recommendations on how often dogs should get revaccinated or boosters?
Oh, yeah. Oh, 100%.
Oh,
Yeah.
oh, good.
Yeah. I mean,
Oh,
this one's easy. That's an easy one. That shedding one, I'm going to get back to you guys on, but this one's an easy one. So I don't manufacture vaccines, right? I'm just a veterinarian.
absolutely.
Right. But at least in America, I have to remember we have an international audience, which is
We do.
so awesome.
I know.
I know we have an intercontinental audience, right?
Mhm.
Like, so at least in the United States, and I think it's similar in a lot of Western countries, to be sure. In order to get that license for the indication on the bottle, right? They have to do testing for duration of immunity.
Okay.
And so duration of immunity, how long does it last? Right. And so if you want to know when they need to be boosted, or should they be boosted, or how should we administer this vaccine in order to actually provide the protection we're looking for, it's not rocket science. You read the insert, the manufacturer's guidelines, because that's what's going to be the proof, right? Because they had to provide evidence for that.
So would it be wrong so now I'm flirting a little bit on the slippery slope side of things, because pet parents,
yeah,
and most facility owners are pet parents too.
Yep.
That's, call a spade, but we don't get the insert.
Oh, well, but you can find it online. God bless the internet.
Okay, so I'm standing in the vet office and I guess it depends. Oh, okay. So as a facility owner, when you're trying to make one, I guess, golden rule of, you need your booster, your Bordetella booster every 6 months versus 1 year or something like that. It may depend on which one they're getting.
Yes.
And I guess that's really up to the facility owners to bridge those gaps with the veterinarian community to make sure that there's good communication to say, okay, what are you giving this year and how long is it effective for? Would that be a fair statement?
That would be fair. So I don't, this is where we really have to have much better cross flow of information and understanding, because do I think that the person who I'm boarding my dog with should have access to all my dog's medical records. Yeah, not necessarily, right? Not necessarily. As a veterinarian, am I going to provide all those records? Only if the dog owner tells me I can, right?
That's right.
And so I'm not saying we need that level of transparency, okay? But from a preventive medicine point of view, I don't think it's inappropriate for a boarding facility to maybe have a form that is completed by clients before the first time that they're going to drop off. And they should maybe indicate by what route was the vaccine administered, and have a blank on there that says duration of immunity, because then they can get that completed by their veterinarian
Right.
before boarding. And you could put that online when they book their their boarding. They got to complete that form, because okay, owners don't know that answer to that question either, right? But
Right.
they could also, if you as a facility have developed a rapport with your local veterinarians, which I always recommend, and not all of them are going to be great. It's not like I think everybody is, Dr.
Jen.
Dripping rainbows and gumdrops every day, right? No, I'm not saying that, but I'm saying make the effort, talk with them, and understand that every veterinarian arrives at their decision from a different path, typically.
Right.
And so you can ask them what they use. Feel free. Most veterinarians will tell you. And if you need them to complete that form, have them complete the form. I don't see anything wrong with that.
Okay, that's fair. Because we don't know. I mean, the big thing is we don't know what we don't know. So,
of course.
I mean, for a lot of people who work in the industry, the Bordetella vaccine is a Bordetella vaccine. Like, we don't know that there's 40 different kinds. And as a pet parent, there was just a comment on here that says, I've never been told which specific vaccine I'm getting, wouldn't know which one to look up as far as the manufacturer. Now, there are the stickers on the thing.
Yeah.
Some of them are from a layman term. I mean, you look at that and you're like, okay, Bronca Shield, which one is that? Is that, for some of the pet parents, that's not their job to know that.
No.
That's our job and the vet's job and I say our job as a pet care facility to be more educated on the vaccine front than the average pet parent.
But here's the thing too, I'm not thinking that every boarding facility personnel, it's not your job to know everything there is to know about all vaccines. It's not your job to know everything there is to know about all these diseases. That's sort of my job, right? And so that's what I'm saying though. We have to bridge the gap and have the communication, because I need to stay in my lane as the veterinarian, right? I mean, I'm not telling you how to run a boarding facility, for heaven's sakes, okay? But I need to stay in my lane, and you got to stay in your lane.
Yep.
But you know what? It's a dashed line between the lanes. We need to work together, because again, at the end of the day, all we're looking to do, the only reason to have any of this angst and discussion is because all of us are interested in providing the best care and the best life possible for the pets, right? We are all on the same team, and that means the pet parent as well. And so the more information all of us has together, the better decisions and choices we can make for all of the pets in our care. And that's all it is. But that's not like walk around knowledge. You don't have to memorize that stuff. That's why you should have a veterinarian engaged with your facility, not full time, not whatever, but make a friend with a veterinarian.
Yeah, absolutely.
Mm-hmm.
I mean, and we should be doing that anyway. One of the things that we say to our clients is, the triangle of pet care. There's the pet parent, and then there's the veterinarian, and then there's the pet care provider for everything non-medical.
And that's what PAC does, like you guys do with your certification. Right.
Mm-hmm.
It's kind of like, heads up, folks, stay in your lane, but you can look over here. And the same thing that IBPSA does with their facility standards is recognizing the need for that phone a friend relationship with a veterinarian. And so all of those things together are trying to elevate that standard industry wide. And I think that's a great thing, which is why I love to do these sorts of events and talk with folks across the spectrum.
Yeah, I think that's fantastic. I think we do need to close that gap. And
Mhm.
we're also, as pet care facilities, we're going to do so by being more professional, right?
Yeah.
By having educated conversations with the veterinarians.
Mhm.
So let me go down the little bit. So I'm trying to get, some of the pet parent questions answered. I'm going to scroll
Yeah.
back through some comments because there's a couple of questions I missed. So Peggy, I haven't missed your question. I just got to go back and try to find it in my Facebook feed here. But why don't we answer the big one? How do you get rid of it?
Oh,
So
oh,
in a
yeah.
facility, how do you get rid of it? So people are
Yep.
like closing for a week, closed for 2 weeks, but does a mycoplasma only live on surfaces for 24 hours because it has no cell walls? And
Yeah.
what?
Yeah.
It's in my facility. I got 2
Yeah.
dogs coughing.
Yeah.
How do I get rid of it?
Yeah. So how often do you actually know what it was?
Yeah,
I mean,
never.
right. Okay. So let's just start there. So if
Well,
you,
now I say never, and this brings me back to Peggy's question because never
sometimes you
is
do.
the vet has said it's kennel cough, like immediate. And we know that Bordetella can't even be diagnosed on the spot. It needs to culture and it needs to, whatever. So the
Mhm.
client comes back and says, my dog has kennel cough
Kennel
or
cough.
whichever. So,
Mhm.
here's that,
Yeah.
perpetual fight that we're fighting. But
Yeah.
but if I have this, you're absolutely right. I don't exactly know what the heck it is.
Mhm.
3 or 4 dogs are coughing in my facility. I'm getting calls
Mhm.
each day with dogs that have gone home, they're coughing. So I'm like, I need to
Mhm.
break this cycle.
Yeah.
How do I get rid of it?
Yeah. So most of these don't hang in the air very long. Okay. So people worry about like we gotta leave this room empty for however many days, etc. Yeah. Most of them don't hang in the air very long because they need the respiratory droplet, which falls to the ground, right? So what you really need is how am I going to disinfect
Okay.
for and kill whatever this bug is. So there's two things that the two biggest mistakes people usually make is one, you have to clean first. Okay. You can't disinfect organic matter, right?
Right.
Like people always say when you go to the beach, like put a towel down first, right? Because like there was an outbreak of hookworms in people because people laid directly on the beach. And I grew up on a farm and my mom always told me lay the towel down first, right? People's solution, what they wanted the city to do in that context was they said you should disinfect the beach. Yeah. Okay. Well, that's not happening. You cannot
Right.
disinfect organic matter. So first you have to clean. All right. And you want to clean, you want to be careful, cognizant of aerosolizing any of the material you're cleaning. And by that, I mean pressure washers, high pressure, even just high pressure from a hose can aerosolize. Because remember, you get this mist and spray, especially in an enclosed area. This is no good. If you're going to do that, then you need to provide appropriate personal protective equipment like a mask and some goggles for your people. Okay.
Right.
Because you're aerosolizing stuff. All right. So there's that. So we're going to clean first. Use soap. Okay. So after you've cleaned, then you're going to put a disinfectant down. So you want to pick a disinfectant that is effective against the majority of the pathogens you might be dealing with. So there's a lovely chart that's available on the internet at the Iowa State Center for Public Health. I'm going to send you a link, Stephanie.
Great. No, that's awesome. That's awesome.
Yeah.
I'll share it on the pack
So,
page.
yeah, there's a table. And when you look at your product that you've selected, because there's a bunch on the market, right? You want to look at the chemical name, it's going to be on that chart. So you look there and then you want to look and see what it will disinfect against. And they also have like examples of different
Right.
diseases. And if you have, in fact, a diagnosis and you don't know if, for instance, parvovirus, if that is an enveloped or non-enveloped virus, and you don't know if, Bordetella is that like a mycoplasma or is that a staph? Like, what am I looking at? It's all Latin to me. Hey, call the veterinarian
Right.
or Google it
Okay.
or reach out to the manufacturer of your chosen disinfectant. There's all kinds of ways you can find information. For zoonotic pathogens, you want to be particularly vigilant, right? Zoonotic ones we can get as well as pets can get. And I'll also send you some PDFs of some infographics I did about disinfection against like the what I consider to be like the top most common zoonotic pathogens that you find with companion animals. I'll send you those. They're very lovely. I did them in combination with rescue. Anyway, they're really great. Okay, so I'm going to send you that because it has like guidance on disinfection and stuff. The number one error people make, I don't care which one you picked, which disinfectant product you picked, is they don't leave contact time.
Right.
Well, how long do you have to leave it? 10 minutes? 12 minutes, 15 minutes? It depends. And you find it on your label of your disinfectant. I don't manufacture vaccines and I don't manufacture disinfectant. So I read the label.
Fair enough. Hey, that's fair. Yeah. I look at that and say, okay, so if it doesn't stay airborne for long and I want to break the cycle, I mean, and not boarding facilities can't always do this because they have continuous guests, right? But if I really wanted to break the cycle, theoretically, if I closed my entire facility, vacated it of all dogs and cats and anything living other than staff for 24 hours, and then went in with soap and water in a bucket and cleaned, and then sprayed my disinfectant, whether it's, you know, watchdog,
appropriately,
whatever,
appropriately,
right? Let it sit. To have the contact time, whether it's, you know, this is a big thing for facility owners, a big thing. This is a, hey, it's only a 5-minute contact time, or this is a 12-minute, or, you know, we're all looking for that 5-minute contact time, right? Because it makes things faster. That's just the reality of it. Yeah. But okay, I've got a 5-minute, 10-minute, 12-minute, 15-minute, whatever. I do that, and then I should be rinsing it off. The
depends on the manufacturer guidelines.
Right. Yep. Depends on the product, whether you let it air dry and set. And then from the next day, if I have dogs come back in that don't have this CIRDC going on, I should be good to go.
I mean, theoretically, yes. If you did that appropriately, yeah, you should. Now, the other thing that you want to consider, I'm not sure if this comes into play with the current like IVPSA accreditation standards, et cetera, is the air circulation, air turnover time. Like how many air exchanges do you have? Because that is another key, but that's also a key to animal welfare considerations and all of that sort of thing as well. So there's a lot of variables, and I would say that every facility is likely to be on a case-by-case basis, right? I'm not going to make a blanket statement here that says, you know, and if you say that, oh, Dr. Jen, the vet said that we could just do this, I'm going to call you a liar. Okay. Yep. I'll deny it. And
don't say Stephanie Shipley said that either, by the way. We were talking in theory, just to be clear.
Because every facility is different, and then you have to do the things appropriately. So you've got to clean effectively. Okay. Then you've got to use your disinfectant according to the manufacturer directions for it to be efficacious. You have to pick one that is efficacious against the majority of the pathogens you're dealing with. Okay. If you do all of those things and you have your air exchanges, because there's things you can do with air exchange too. There's things you can do that are not very expensive that can help to disinfect airborne pathogens in the air. Right. I mean, that's just like tossing that out there. And if you do those things, then I would say you've done everything possible to eliminate those pathogens from your facility. Now, the moment you let live animals back in, of course, they could come back in. It's true. Okay. But you have your protocol, right? You adhere to your protocol for a reason. You get proof that people are complying with your protocol. And then you never look back. You move on. Okay.
So as a pet parent, what is, generally speaking, in your experience, what is the treatment plan for a hacking dog? Yeah.
So for me, when they come in, The questions are, how long have they been doing it? How old are they? Because there are a lot of things that can make a dog hack. Okay. It's not just CIRDC. It's not just upper respiratory. A lot of things can cause it, right? So if I eliminate heart disease, if I eliminate, fungal disease, if I eliminate whether or not it's a pneumonia, a fulminant pneumonia versus just an upper respiratory disease, then I look at the overall kind of stage of disease. Is the dog eating and drinking? Does it have a fever? Does it not have a fever? Is the dog lethargic? Is it dull? Is it quiet but alert and responsive? And how long has it been going on? Does it have any other accompanying signs? Does it have vomiting and diarrhea? Has it not eaten in 2 days? Because if it hasn't eaten in 2 days, it's not drinking either. Does it have nasal discharge also? How much nasal discharge? What's the character of that nasal discharge? Is it thick? Is it colored? Is it constant? Is there sneezing along with the coughing? What's the character of the cough? Is it deep and productive? Is it, what's the frequency of the coughing? Are they only doing it in the evening when they lay down to watch TV with me? Are they only doing it after they run after the ball twice?
Right.
When are they doing that? And so there's a lot of things that go into this. For me, not just, well, I don't know, did you board them over there 2 weeks ago? I mean, it's not, it's not just.
Oh my
one
God, we
thing.
love you. We love Dr. Jen
yeah.
Vet.
Yeah.
So generally, like in our local area, the veterinarians will say, a cough suppressant that doesn't have xylitol in it might help them to get some sleep or something like that. But if they actually diagnose it as a CIRDC and they've got a dry cough that sounds like they're honking, traditionally, rarely are antibiotics prescribed, but I have heard of antibiotics being prescribed to some degree. People can watch your Chat with the Chatfields on antimicrobials if they want more information on the overprescription or appropriate prescription of antibiotics. But that's another. We're going to talk about Chat with the Chatfields here in a minute. But,
yes.
But generally speaking, as a pet parent, normally does it kind of run its course on its own and you kind of listen to the dog hack a little bit, and if any of those other things that you just mentioned come into play, I should be going to see my vet right away?
Yeah, so probably 15 years ago I would have said yes, but now given what we know, I recommend contacting your veterinarian earlier rather than later. For guidance on, do I need to bring it in right now? Or should I wait a couple days and see if this will run its course, isolating my pet from other dogs during that time, to see if it's just viral. But the fact that the majority of the time, if it's upper respiratory, it's multi-pathogenic, it's not likely to get better on its own if it's an infection. And so I would rather not wait, because, bad news doesn't get better with age, right? So I would rather start treating it right away. Now, kind of the shame of it all is that almost all of these infectious agents cause a cough that is persistent. So even if you eliminate the bacteria, if the virus has been eliminated by the dog's immune system as well, they continue to cough a little bit for a while. And that's kind of what's horrible about it, right? Little kids do the same thing, but I digress. So for me, if they come to me and let's say they came early, right? I say, number one, I say, oh, good on ya, right? I like to tell pet owners when they do a good thing. Thanks for coming early, because your dog is still eating and drinking. Your beagle is still wagging his tail and running around, sniffing everything in my exam room. And it's only been coughing for 2 days, right? Because you picked it up on Sunday, you couldn't get here on Monday because you just got back to work after a week of vacation, so you couldn't get here. So here you are on Tuesday morning. So a lot of times I will do maybe 5 days or 7 days of antibiotics. I rarely do a cough suppressant. I rarely do a cough suppressant. I have to be really confident about what's causing that cough to suppress it, because the body coughs for a purpose in dogs.
Right.
And if there's inflammation, well, why don't I just get rid of the inflammation that's causing the cough?
Right.
Right.
No, that's fair.
Now, when the majority of these we thought were only Bordetella, and it's that dry hack that's been going on for 6 weeks, okay, I'm going to try to suppress that cough.
Right. Right.
But
because nobody in the house is sleeping,
correct,
including the dog.
Right. And that's no good, right? The other thing is sometimes those dogs are hacking so much that they just feel like crap just because they've been hacking.
Right.
Not because they have an infection still, they're just hacking, and then they don't eat. Right.
Right.
That's no good. I don't want that. They need to eat and drink so they can finally get over this. So yeah. So for me, there's not any real kind of, in a nutshell, these are all the things I do because there's so many variables that come along with each coughing dog. So it is, for me, it's a little tricky.
But I think that's very valid, because there's so much that goes into it from a veterinarian standpoint. There's also so much that should be going into it as far as a diagnosis. And I think that brings us full circle back to
kennel cough.
Right. You can't just toss us poor kennels, under the bus. It's just this broad sweeping term, because you're absolutely right.
Yeah.
One thing that one of the things that I've learned about this session today is that there is so much that goes into it. Mm-hmm. It is almost an injustice to just lump it into some archaic term that doesn't really tell the pet parent anything.
Right.
Really,
what it tells them, a lot of times,
going on.
No, but a lot of times what it tells them is pet parents feel terrible. Like if I say, oh, your dog's got kennel cough, well, who took him to the kennel? Right? Like, that's not fair, you know? But if you've done the preventive medical recommendations that I have made, if we've maintained those good vaccination practices, if you've maintained your dog in a good nutritional plane, if all of these things culminate in the likelihood that you won't face this with your dog,
right?
That it's safe for them to go to the kennel. It's safe for them to go to doggy daycare. Now dog parks, gosh, from an infectious disease standpoint, like, oh my God, the dog park, oh, the cesspool, right? However, I recognize some people, that's where they can take their dog for them to run around and be free. So let's just vaccinate the tar out of it. No, I'm just kidding. But let's make sure that we don't miss on those preventive practices with those dogs. Yeah. So if you keep up with those things, you're vigilant as an owner, you're informed as an owner, you've done everything you can do to create a circumstance where you can avoid this infection in your dog. But sometimes it's still going to happen. It doesn't mean you did something wrong. It doesn't mean the facility did something wrong. It means God said so, and the bug decided to set up shop in your dog's nose. Because it can still happen, but you've done everything you can to prevent it. So, yeah.
And at this point, with all of the knowledge that we have about, COVID-19, we should be much more affluent in how vaccinations work, and that even when you're vaccinated, you could still get it, but it makes you less sick, or, whichever. So maybe some of that would apply here as well. I only have one more question, because we're almost out of time, and I promised you that I would let you have your evening after 8:00 Eastern.
Yes.
Can we just talk just for a second about incubation periods? When a dog comes in contact with a parainfluenza or whichever, how long before? Peggy Hale from Maryland says that it's the incubation period. That's what gets asked. No symptoms, no, they're shedding, they're spreading. Like, how often, how long does that happen before they're not contagious anymore?
Yeah. So I'm going to speak in generalities here, because remember, we do ourselves a disservice if we focus on a single pathogen, because we know that this complex is a complex because there's multiple pathogens involved, right? And incubation periods are interesting because we do worry, Peggy, as you mentioned, about asymptomatic transmission. Like, how good, how efficient is a dog at giving the infection away before they even know they're sick, before they show any signs? Well, the answer is with almost every pathogen, they're terrible. They are not efficient at giving away these pathogens. Doesn't mean that they can't do it, right? We know, like with influenza, we know that they can shed that effectively for 48 to 72 hours prior to the onset of clinical signs. We also know those clinical signs start kind of slow, so we might not notice them. We're not perfect pet parents, right? We might not notice. So that could be another day or two where they could be transmitting and we don't recognize it. So again, vaccinations prevent against the infections you don't know about, because no one in their right mind is letting their dog run up and touch noses with a dog that looks half dead, hawking up a lung on the sidewalk. No one's doing that. I hope no one's doing that, right?
Right, but you're right.
But you may not know, right? Because maybe that dog just is a little pukey that day and no one noticed. You don't see it. Okay. So again, it's the prevention that's worth way more than the cure. Okay. So as far as if you're going to board your dog, is it safe? What do I do with that as a facility operator? You stick to your protocol. There's a protocol for a reason. You can't let there's a reason that you require that vaccination be up to date. And it's because we don't always know who's shedding what and when they're doing it, right? Like there's a saying in the South, you got to know who's doing what to whose old lady, right? We don't know who's doing that. We don't know what's going on at any single point in time with every single dog coming in and out of a facility. So I don't focus too much on incubation periods.
Okay.
Because what is that going to tell me? Now, if you're trying to count backwards from an epidemiology standpoint and determine whether or not a dog got that at your place, then you need a confirmed diagnosis of what it is. And then you need to determine, did they actually get it at your place?
Right.
And then at that point, I think you need to have your veterinarian for your facility in the discussion, because then for those specific pathogens, you can look up what the range of incubation time is. Because again, it's a range.
Right. And that's fair, because, and as facilities, for the most part, we're dealing with, we require Bordetella vaccine or don't, or whatever, but that's one single element of.
And if you require Bordetella, you should be requiring canine influenza at the same time.
Canine influenza?
Influenza at the exact same time, because the risk profile is 100% the same. I don't care what the veterinarians are telling you, because I tell veterinarians, if you're vaccinating for Bordetella, you should be vaccinating for influenza at the same time, because the risk profile is the same. And if they're at risk for Bordetella infection, then they are at risk for influenza.
Okay, fair enough. Everybody hear that straight from Dr. Jen, the vet.
That was my mom voice too. Did you?
I loved it.
Did you hear it?
I know. I saw the passion come out. You said that when I did chat with the Chatfields, you guys said the same thing. You said, "Oh, that's fiery." Mm-hmm. So you guys pointed out, but that's good. I love your passion. I absolutely love your passion. So we're going to kind of wrap this up now, because Jen, it's 9:03. I wanted to thank you very much for your time today. I hopefully we can do this again. We've had lots of great comments and feedback on the comments already, and then we're going to post this online. It's going to be available. For those of you who are watching, I'm going to get this out of the way right now. We have a CEU code for anybody collecting pack CEUs. It is C as in Charlie, 10276. CC 10276. And for those of you who are collecting pack CEUs to renew your certification. If you haven't had this, you know what, Dr. Jen, I'm going to talk about you like you're not here just for a second, okay? Because there are some pet parents on here that I am familiar with as well, and they would be able to attest to this. They're clients of Paw and Order, and they would be able to attest to this. But I cannot tell people enough about how much I enjoy the Chat with the Chatfields podcast, because it's the only podcast that I have listened to every single episode. I subscribe to it so a new one comes out and I don't miss it. if you are watching this and you have not listened to Dr. Jen and Dr. Jason on Chat with the Chatfields, it's on Apple Podcasts. There's a YouTube channel. If you search Chat with the Chatfields, if you haven't, I highly, highly recommend it. It's so informative, but my God, it's so entertaining. It is so bloody entertaining, and the guests have been wonderful and also entertaining.
And we had so much fun when you came on the show.
We did have a lot of fun. We did have a lot of fun.
We did.
But if you're watching this right now and you haven't tuned in to Chat with the Chatfields, my goodness, you just couldn't find a better one. It's my favorite podcast. I tell everybody, look, it's coming in now. People are like, yeah, awesome podcast, great, true story, awesome podcast. So, you know what, if you want the information, but you want it in a little bit of a lighter, less depressing, you know.
We don't like to be depressed.
No, it's fun. The chat room is a fun place to be, and pet parents and pet care facilities and pet providers will absolutely love it. So I highly recommend that you tune in to hear Dr. Jen and Dr. Jason. Dr. Jennifer Chatfield, thank you so, so much. I enjoyed our time. This will be posted for people to watch after the fact as well. And you're going to send some deliverables over that I'm going to post on our Facebook page. And we're going to get some even more questions answered. But we, you know, as the chair of PAC, and there's a lot of board members on this call right now too, I'd like to express my sincere gratitude, because this is beating up the pet care community and pet parents pretty good right now. And there's a lot of pet care facilities that are tired. They've spent 18 months hanging on. Now they have no staff. And now, you know, a Canine Cough or CIRDC is running rampant, and facilities are just getting tired. And we needed a little bit of education for both the pet parent and the facility owner on how to crawl out from underneath this proverbial rock, so to speak. So thank you so much for helping us with that tonight. And I hope that you'll give little Cosette a hug, kiss, and a squeeze from all of us that are watching tonight too.
I will. Thank you so much for having me on. I love this. I love the questions. That's so wonderful. I love how you guys, your audience is so engaged. So yeah, and I love what PAC is doing, trying to offer that opportunity for pet care professionals to further their professional development. I think it's wonderful. So anytime I can support that effort, I'm happy to do it. Yes, please. I would love if you guys drop us a line on Chats with the Chatfields. You know, if you listen to the show on Apple Podcasts, you know, rate us and drop a review. We would love it. Send us a topic suggestion. If you have a topic you want us to talk about or something like that, we're open. We love it. So yeah, so please, we do our podcast because we enjoy it. And so we hope it's not depressing, because that would mean we are depressed, and that's terrible. So anyway, so
Kathy Hennessy, by the way, Kathy Hennessy just posted open Spotify Chat with the Chatfields link in the comments for this Facebook Live.
Oh, cool.
By the way, so anybody that wants, just click on that link that Kathy Hennessy posted for you, and you can subscribe to Chat with the Chatfields. You will not be sorry. I guarantee it. You will not be sorry. And if you are, you reach out to me personally and we'll have a chat about it, because it's phenomenal.
Oh, that's awesome. I love it. Thank you so much, really, for your kind words, and everyone for tuning in. And yeah, I would love to do this again. I do really enjoy talking with everyone who's part of a pet care team. So thanks so much for that.
Thank you so much, Dr. Jen, and we will see you in a couple of weeks in Orlando, Florida for Heroes for Healthy Pets.
That's right. And come by if you're at IVPSA, even if you're not registered, come by the room and say hey to us. We would love it. We'd love it.
That's awesome. Thank you so much, Dr. Jen. I hope that you and Cosette have a wonderful evening snuggling on the couch together. And we'll see you in a couple of weeks. Thanks, everybody, for tuning in, and we wish you a wonderful, wonderful evening. Bye for now.